Good morning, everybody. Welcome to this morning's meeting of the Complex Rehabilitation Technology and Wheelchair Repair Advisory Council meeting. I'm John Slifka. I'm one of the co-chairs, and I represent the Department of Aging and Disability Services as well. I don't think that we have anybody new. Actually, we do have our one guest here. I mean, we all know each other, so maybe we'll go around and we'll do introductions very quickly, so that everybody knows who everybody is. And we'll start with folks in the room, and we'll start with Miss Johnson over here. Oh, okay. Sorry, Miss Johnson. We'll move on to the next person, Mr. Prizio.
Good morning, everybody. Adam Prizio with the Office of the Healthcare Advocate.
Good morning. I'm Vera Garland, disability rights activist and chair of the CT Wheelchair Reform Coalition. I'm Maureen Amiro, co-chair and representing Citizens Coalition for Equal Access.
Okay, and going off the screen, we'll just go in order as to how I see you, Mr. Taubman.
Good morning, everyone. I'm Sheldon Taubman, litigation attorney with Disability Rights Connecticut.
And Mr. Roop.
Morning, everyone. Thanks for being here. Daryl Roop, wheelchair user over 20 plus years, paraplegic, also occupational therapist and ATP.
Mr. Gilberti, nice to see you again, sir. You're on mute, Mr. Gilberti.
My apologies. Gary Gilberti, I'm with New Motion. I appreciate the opportunity to be here and participate in this committee. Thank you.
Thank you. Mr. Seifel.
Hi, good morning. Dave Seifel, Legislative Affairs at the Department of Social Services. Happy to be here. Thanks.
And Ms. Mahoney.
Jenny Mahoney, Department of Social Services, Medical Policy.
Okay, and Ms. Rasko.
Good morning, Diane Rascott, Vice President, Payer Relations, National Senior Mobility. Good morning.
Good morning, Mr. Carson.
Hi, Jim Carson, Legislative Program Manager at the Connecticut Insurance Department.
Okay, and Ms. Skyers-Thomas.
Good morning, everyone. I'm Shirley Skyers-Thomas, Deputy Commissioner at the Department of Consumer Protection.
And Mr. Short.
Good morning. I'm an advocate with Independence Northwest and longtime member of this wheelchair committee, and also been a wheelchair user for 20 plus years.
Okay, and lastly, Mr. Morgana.
Good morning, everyone. Wheelchair user, disability advocate. Thank you.
Thank you, Ms. Johnson. Okay. With respect to opening comments by the chairs, remarks by the chairs, the only comment I want to make is just a reminder that any inquiries that need to be done, any questions that need to be asked, either of other members of the committee or it's outside of the committee, just please direct those questions to the co-chairs, and we will be happy to ask the questions on behalf of the advisory group going forward. So, thank you. Did you have anything? Okay.
All right, thank you. Does anyone have any changes to the minutes or any amendments? If not, I'll entertain a motion to approve.
So moved.
Second. Do we need a second? Oh, Okay, those are approved.
Okay, and just as a quick comment that we had discussion and there were emails as well last month back and forth about adding someone from New Motion as a guest to our advisory council going forward, so that they could be here to answer questions on behalf of their company. And so Maureen and I went ahead and we invited Mr. Gilberti to be a part of the group. We're grateful that you're here again, sir. And we look forward to working with you here going forward. Thank you.
Okay, and now we'll move to the data presentations. We'll start with Adam. Yep. Okay, we're going to start with Adam and his presentation of data from the Office of the Healthcare Advocate. Thank you, Adam.
Thank you, Madam Chair. I'll wait for the screen share to catch up. Thank you, Chandra. All right. This is my presentation on the really it's sort of the first 2.5 months of data collection for this task force. It's my intention to present with the chair's permission every month a cumulative report of what we've received. But next slide. Very briefly, the Office of the Healthcare Advocate is a state agency that was created in 1999 as the Office of the Managed Care Ombudsman. The name was changed by legislation in 2005 to the Office of the Healthcare Advocate. We are a staff of nurse consultants, attorneys, paralegals, and other professionals. And our job is to assist all Connecticut consumers with healthcare and health insurance issues. The classic case is where your doctor orders a procedure, but your insurance doesn't think it's necessary. They deny it. We help with resolving that by appealing or coming up with another way for you to get what you need. Our services are free of charge to the consumer. Next slide. We were added to the we were included in the Public Act 2458. There are which adds new statutory duties to our current workload, and those are on the screen, but I'll read them as well for the benefit of those who may not be able to see. On and after July 1st, 2024, the Office of the Healthcare Advocate, in consultation with the Department of Consumer Protection, shall maintain a phone number and electronic mail address to be posted conspicuously on the internet websites of the Office of the Healthcare Advocate and the department to receive and record complaints regarding timely repair issues. Not later than January 1st, 2025, and annually thereafter, the Healthcare Advocate shall submit a report to the Joint Standing Committees of the General Assembly, having cognizance of matters relating to general law, human services, and insurance regarding the complaints received and recorded pursuant to this subsection. And I've bolded some of the language which captures what it is, the verbs essentially that we're supposed to do. Maintain the phone number, receive and record complaints, and submit the report. Next slide. We were also added to this body, Complex Rehabilitation Technology and Wheelchair Repair Advisory Council. And I've again bolded the verbs to monitor repairs of wheelchairs and to make recommendations concerning improving improving repair times. Section B8 adds the healthcare advocate or the healthcare advocate's designee, which in this case is me. Next slide, please. So our process for receiving and recording complaints, I went through the statute and this is in flux, and I welcome the committee's input, but I went through the statute and looked at the data points that were indicated throughout that that the committee should be looking at, and I came up with these sort of broad categories of information. When was the request made? To which company? When did the company respond? When was the assessment done? When were parts ordered? When were parts received? When was prior authorization requested? When was prior authorization determined? And when was the repair completed? Now, a consumer who comes to us may not know all of this information, but just in case they do, we're asking questions that get to all of these points. Next slide. So as part of our broader statutory mandate to assist consumers with their healthcare related issues, we, sort of synthesizing these two statutes, we receive and record complaints, but then we also assist consumers by participating in and advocating for the resolution of their healthcare related issue. So in order to advocate, we also need to collect a HIPAA release so that insurance or the provider, in this case, the wheelchair company, can discuss the case with us and can take our information and take our questions and give us answers. We may also refer a complaint to the wheelchair company, to DSS, to commercial insurance, or to another party as appropriate as the case may be. As I said, the HIPAA release authorizes us to request and receive information about the case, which opens the door for us to advocate for the consumer's rights. Next slide. So this is the data reporting section. Between July 1st and September 18th of this year, we've received 7 total complaints. And I've broken them out. Sort of some of them were complaints that I felt may not fall within the specific statutory ambit of what this committee is doing, or it may not count as a timely repair complaint. So the first complaint, for instance, was a complaint regarding the phone messages, specifically that the phone messages did not include information about timely wheelchair repair, or or include information about referring consumers to our office. We had a complaint regarding a request that was made prior to July 1st. I thought that might not fall in, strictly speaking, into the statute, but that the committee might be aware of it. The request was made on April 30th, and the repair was completed on August 20th, which my calculation is 112 days after the request being made. We had a complaint in which the consumer did not respond to inquiries for details. And then of the 7 complaints, then we had 4 remain, which identify an inquiry after July 1st. No consumers returned a HIPAA form, so I was not able to forward any questions along or participate in the advocacy that we ordinarily do. Next slide. Of these cases, the first case involved a request that was made on July 22nd, and the repair was completed on September 13th. By my count, that's 53 days. The second case involved a request made on July 31st. The repair was completed on August 2nd, which is 2 days. The third case, the request was made on August 14th. It is not known if the repair has been completed. And the fourth case, the request was made on September 3rd, and it is not known if the repair was completed. So the day counts in both of those are sort of a running total until I have learned if and when the repair will have been completed. Next slide. So this is our contact information, and we are here for wheelchair users as well as other Connecticut residents who have issues with or questions about their health insurance or healthcare and their rights under Connecticut law. Thank you. And I'm happy to answer questions.
Thank you, Mr. Perizio. Do we have any questions? Sheldon.
Yes, good morning. Thank you very much, Adam. Just a question, based upon what the coalition group is hearing, there's a lot of problems, and the number you have of complaints is not that large. And I was wondering how that compares with complaints you get, about other things. Like, that classic case you said of the doctor who prescribes something and the insurance company doesn't want to pay for it, which is a different issue. But I was just wondering if you had any thoughts about that.
I do. This seems like a very, very low number to me. It is a new program, but I think that it would certainly benefit from additional outreach, particularly outreach targeted to all wheelchair users, and especially wheelchair users who are seeking a repair. I don't have exact numbers, but we are for this year we are approaching 4,000 total cases, which include both simple inquiries and more complex, cases where we have to become involved and fill out a release and make some advocacy efforts. So, and that's since January 1st, but if you just divide that up by 9 months, that's about, and here I didn't go to math school, I went to law school. It's a lot of cases, and it's certainly more than 7 over 2.5 months.
Can I ask whether, I'm very aware of your office because of the work I do, but I don't know other people do. Can I ask what outreach has been done to, not that it's easy to locate them, but to wheelchair users about the availability of the complaint process through your office?
So for our office, we have the contact information and a section about wheelchair repair on the front of our website. But that only helps people who know to go to our website. We have not undergone a targeted outreach to wheelchair users, in part because, because of resources. One resource, of course, being a list of wheelchair users in Connecticut, which we haven't received, but also have not requested. We have other resource constraints that I would have to talk to my agency head about undertaking such an outreach. But if that's what you're asking for, I can certainly take it back.
No, I wasn't really specifically asking, and I recognize the problem. Not having a list makes it really difficult. Thanks for your answers on this. I will say it's up to other people to volunteer this, but my understanding, besides that it's a very small number of complaints, I believe that most, if not all, of those complaints are actually by, how to say this, people on this council. People who are very, very engaged in what's going on. So again, you can't answer that question, but I'm just, some people might want to weigh in.
I can't answer that question, but I can't. I don't disagree with it.
Thank you.
Do we have any other questions? Okay. Oh, Daryl?
Yes, how you doing? Yeah, so recently I had a certain instance come up with my vendor. I do want to comment that I really do like the transparency that the mynsmorder.com, you could track your order. You put in your order number, you put in your last name, and it's very transparent. I'm on the website right now. I could look at it. I could check it out. I did have a wheelchair repair appointment. Actually, it was going to be a wheelchair fitting at one of the local hospitals. I have been using NSM for a few years. And after I had this appointment, we decided, I'm going to need a chair back. So it was there, easy to assess, in person, boom, should expedite the procedure. That was on 7/18. On the tracking software, it does say step 1, preparing your order. That was July 18th. Step 2 was collecting insurance documentation. It was a full month before that was related, that it said completed on 8/18, so a full month later. Step 3 of 6, awaiting an insurance approval. That was completed on 8/18, and then we received for step 4, the insurance approval was received on 8/19. There was an estimated completion date of September 9th, 2024. Let alone this is not a like complicated repair. It could be done in probably about 10 minutes for a back swap on a manual chair. The estimated completion date was 9/9/2024. Still waiting on that. I did talk to one of the reps that reached out to decide what could be a good date. She did mention when she called somewhat, I think it was a week or two in September. She mentioned the part was at the facility at 9/1. So that I'm not sure what the delay was in reaching out. So I did mention after I was talking to her, we were trying to set up a date for the part to be delivered and the tech to come either out to my work or to my home prior to work. And she did mention, well, based off of we don't have a tech in that area on that day, there would be a delay. So I did, I never reported this to OHA, and I think that's part of the problem. Some of these reports aren't going in. But what I did mention, I asked the woman that was prepping for the delivery if she knew about the wheelchair repair bill. And I found it very alarming because she did mention that that only applies to Medicaid clients. So as we all know, sitting on this council, that's false. So after I did discuss that, I was like, have you guys been trained on any of this information on the new wheelchair repair bill? She did mention yes, in the law. Obviously, I think education, it needs to go out there. We need to notify, we need to, get it transparent, just like the website is. We could track that. I think that was great because that was a great tool, but I kind of didn't want to do it to the OHA just to see how the industry was handling it and all the techs were handling these type of things without going that route. It's concerning, and luckily the tech's coming to my house before work tomorrow, Thursday, but from 7/18 all the way to 9/26, that's quite a long time span. I just wanted to comment on that.
Thank you for that comment. Just a quick question for my notes. You indicated that the insurance request was sent on, I have it as August 18th, and it was a determination was made on the 19th. Is that correct?
Correct. Yeah. So they have step one, preparing your order, then collecting insurance documentation. That's step two. It was sent out. So it was only 1 day for the insurance approval.
Okay. Thank you.
Based off of step 2 to step 4.
Thank you, Daryl.
You're welcome.
Any more questions? Okay. Oh, Farah. So since there are no other questions, as far as I can tell on this topic, my question is, before we move to the next topic on the agenda, I know that we have in an email a note about discussing the law summary, and I was hoping that we could move that up in our agenda, since we seem to be on different pages, different understandings of what the law says. I think it would be helpful for all of us to have the same understanding, be on the same page here. So was suggesting asking to move that forward in our agenda before we move forward with more discussions of in this,
If there's no objection in front of the advisory council, we can certainly move that agenda item up. Okay, seeing no objection, no, we can move. That was item number 7 is the one you're referring to?
I don't believe it's on the formal agenda. I believe we had an email from Chandra. Is it on the agenda?
I think I see item 7, discussion on cease and desist letter
Oh, that's
to
number 7. I'm
NSM
sorry.
and
So,
law summary.
Oh, and law summary. Oh, thank you.
And the law summary. So that's number 7. Yep. Okay. So we can certainly move to that portion of the agenda right, as long as we have no more questions on the current item.
Thank you very much.
Okay, seeing no other questions and seeing no objection, we can move item number 7 up And we still have 2 reports on item number 5 after that. Okay. So the floor would be yours in that instance, Rare, since you asked for the agenda item to be raised.
Thank you. Oh, so in that case, are we on to the discussion of the cease and desist and the law summary? Let me pull that up. I'm sorry, I was only somewhat prepared to immediately be the one discussing this. Well, if we wanted to to start with the law summary.
And before we proceed, just to make sure everybody received that document, it's the timeliness requirements under the new Connecticut wheelchair repair law, PA 24-58. It's a one-page document, front and back. Okay, I'm not seeing any objection, so.
Okay. Oh my goodness, I'm trying to find my document. I apologize. Oh, thank you. I appreciate you. The problems with keeping things digital. All right, so to begin with the law summary, the Connecticut Wheelchair Reform Coalition, the advocates, or the council advocates rather, excuse me, worked together to put together a one-page summary of the new wheelchair repair law, PA 2458, and also conferred with Senator Lesser to ensure that we were in fact on the right page here. And so here is some of the requirements included in this law. Overall, it requires that the wheelchair suppliers repair the chair or scooters within 10 days of the call or email seeking the repair. The suppliers are to respond to a call or email within 1 business day. Wheelchair suppliers are to order any needed parts within 3 days of the need for the same being identified through an assessment or any needed prior authorization having been obtained. Note, no specific deadline for when the assessment must occur after the request for repair is received. It's provided in the law, but the 10 business day clock is ticking on the need to complete the repair from the time the request is first made. So a quick assessment is needed to ensure the compliance with the 10 business day requirement is met. Exception: days waiting for required insurance prior auth or for timely ordered parts to be delivered to Connecticut facilities do not count towards your 10 business days. So the clock is paused during those days of waiting. But once the prior authorization is obtained or a part is received, the repair must be completed in the number of days left out of the 10 business days from the time the repair request was first received. Senator Lesser said very succinctly, the 10 days does not start or start over when parts come in or when prior auth is received. If the need for an additional repair is identified at the time of assessment or repair, all of the above deadlines newly apply to this new repair. And then a note, consumers with a custom wheelchair have the right to an assessment and or repair in their home upon request. Assessments also potentially can be conducted remotely. In that event, all of the above timelines apply to the same extent as in-shop repairs. So hopefully this is helpful and clarifies some things for us all so that we're all working with the same information, which I have found makes everything run smoother for everyone. Is this it? Would you like to take any questions at this time or move on?
Oh,
Or
no, I think we definitely need time for questions and discussion.
thank you.
Of course. Mr. Tapman, you have your hand raised, sir.
Yes, thank you very much. As Farah said, we need to agree on the size of the table here. I appreciate very much Farah asking to change the agenda like that. And it was needed because the industry's report has language which indicates it's not consistent with that summary of the law, with the law. It says, they're saying the number 4, last thing in the report is performance of meeting the 10-day window from all POs after the prescription and prior auth received to delivery, which is to say the 10 days starts all over again. And that's at the last meeting, Diane said that, and I said, no, that's wrong. And the minutes reflect that Diane agreed. And yet this report is produced thereafter, which goes back to that interpretation that the 10 days starts all over again. So it's, I think, really important that we agree on, I mean, if there's any comments to our summary, please, people should speak up. If you think it's wrong or it's missing something, whatever. But several of us spent a lot of time really analyzing the law, trying to make sense of it, including the whole scooter thing, which came up last time. The scooters are like, it's 3 different provisions, and the critical provision on the timeliness does apply to scooters, but other provisions don't. I mean, that's the way the law is written. Anyway, so that's why I agree that this is really important to discuss now and figure out if there's any remaining disagreement. Thank you.
Thank you, Mr. Tapman. Are there any other comments at this point?
I do have a comment, if I may.
Yes, absolutely. Please. Thank you.
I want to have a clarification first to go back to what was Cheryl from Darrell. And I want to be very clear because section of this about all, because this is part of the bill's challenges that we have saying all insurance plans follow the guidelines, follow the same things. And in it, section 55 lines 1 through 60 is specifically states about the Medicaid. So this was a Medicaid based bill on this, and that's how we were interpreting it. So I need another clarification here, because if we're applying this to all plans, regardless of insurance coverage, because the bill at the beginning, we had those challenges with the industry that was there outside of Medicaid office. I need that clarified ASAP, because we are prioritizing our duals and the Medicaid recipients because of this law. So unless something's differently interpreted in here, I need clarification on that today.
Okay.
Because UHC, our other insurance plans have their own stipulations and stuff. So if we're going to go off and say all clients, I need to understand that, because that was not what was stated during the work group before when this was drawn up. The focus of, we even brought this up during a conversation that you're going to be very heavily focused on the Medicaid. It's going to prioritize the Medicaid clients. So now we're stating differently here. I need clarification on that, first and foremost.
And that's certainly something that we can go back to the
Please, yeah, because that's going to even add more.
We will certainly go back and ask the question. I obviously can't guarantee that we'll have an answer today, but we will certainly ask that question on behalf of the advisory council back to the leadership and the ranking members of the committee. Mr. Taubman, you had your hand raised again.
Yeah, I mean, we don't have to go back to legislators. It's like you can't. What Diane said is not supported anywhere in the law. And I was there for all the task force meetings as well, and that is not true, that it was limited to Medicaid. In fact, most of the people on the task force who are consumers are not on Medicaid. And the concern was discussed that it's a problem throughout the industry, even though the data is that most people who use this kind of equipment, it seems that the majority are on Medicaid, but that was not the limit to it. But regardless, you look at what the law as passed says, and sections 1 and 2 that talk about timely repair and the 10 business days, there is no reference to Medicaid. Whereas in the sections that talk about removing prior authorization, that specifically talks about Medicaid. So, really a most basic rule of interpretation is where the legislature talks about something in one section and doesn't talk about the other, it meant that. And there's nothing in here, nothing in this entire law that suggests that the critical pieces about timely repair are in any way limited to Medicaid or anything. It talks specifically about authorized wheelchair dealers having to, quote, timely repair a wheelchair. There's just nothing in there that says otherwise.
Mr. Crizio.
Thank you. I'm not able to give legal counsel to the industry, but my reading of the bill is substantially the same as Mr. Taubman's, that sections 1 and 2 apply to all wheelchairs, all wheelchair users, and let me get back there, to an authorized wheelchair user, which is any company doing business in the state selling or leasing wheelchairs, including complex rehabilitation technology wheelchairs. And a consumer means the purchaser or lessee of a wheelchair, including a complex rehabilitation technology wheelchair, irrespective of whether the purchase or lease of the wheelchair is funded in whole or in part by the consumer or privately or publicly funded health insurance. So that seems to me to indicate that consumer is anybody who buys or leases a wheelchair, regardless. So I just wanted to read those two sections into the record.
And I'm going to make a statement right now and then, because during all of the work groups all along that time before this bill got finalized in May, that was not the intent, Sheldon. And I am going to take this back, because now this is going to change the whole analysis of what we're doing and how we're looking at this. So I want that for the record. We will go back internally on this and follow up.
And I think in the interest of transparency and fairness, we should ask the question of the leadership of the committee, the leadership, the ranking members, LCO potentially. So the co-chairs will take that back and get an answer from those that that drafted this language, just to be clear, as was asked of them previously on the interpretation of the 10-day rule. I think that's again, just in the interest of fairness and transparency. Mr. Taubman.
Yeah, I mean, I have no objection to that. I can't imagine getting an answer other than the obvious. But I guess the question I have is two questions. Was the report that was produced limited to Medicaid and everything else?
It was anything with Medicaid, whether it was secondary, primary, it was all inclusive. Right, so most of them are duals anyways, Sheldon. So no matter what, if there was a Medicaid, either primary or secondary or whatever, we pulled those. So
but not a commercial only though?
Not commercial only, okay. No. But majority of them, though, Sheldon, like I said, over 65% are dually eligible anyways. So, I mean, it's still going to give you the trend and where we're going with all. But this is, again, what we're trying to prioritize and trying to track really closely was pulling it by this being primary, secondary, or whatever in our systems for reporting. And it's a nightmare pulling all this together. I'll share that with you guys when we get to our section, but this now is going to have to interpret a different way, and it's going to be a different workflow now, how we look at all this, right? So one is not just new orders since July 1 that we're getting requests for. Don't forget we got our history and all that other stuff that we're still trying to build out. So I need clarification as soon as possible, because this is going to change how now we're doing reporting, how we're going to track, and how we're going to be compliant on top of this. So being fully transparent here, so for the benefit, so I can go back to our internal team at least, and then look at all that stuff too. So that, when that was brought up, then my alarm bells went off. So, and when I looked at this and all the interpretation during the conversations at the end, it was so focused on what the state had the ability to control and dictate, which was the Medicaid lives, and what they had to overbill for that. So, and I'm going to go back to my past notes too, but regardless, it doesn't matter. This is not to be, we'll get the answers from that after this, from the committee and how it was written up. But I want to be fully transparent. So like the numbers like I shared, what we tried to generalize because every system's a little different how the suppliers were doing this. It was looking at those, and that's how it was pulled in. And so full transparency when we discuss this and go over, I mean, I have more details and Gary has his stuff he can share, but I want to get to the point where we're going to get to. And at the end of the day, the objective of this committee is, one, are we improving on the timelines and getting there, and how we're getting there in compliance to the bill? And you know, that's what we're trying to get to. And all the things that go into it. And hopefully this committee will help too, because I know myself as our company, we're challenged with labor. And you know, right before this started, 2 of our techs quit, and then during July we had 2 techs out with COVID. That screws up the numbers. And you know, are we going to be 100% compliant with this? I would say never, because life happens. But we do have the tracking and why we're at and what we're doing, and is there improvements going in the direction it's supposed to? What the intent of this, right? And it's just, I got to make sure, for the sake of this committee, we get true clarification around all of this, so we can go back and make sure we update our systems, do whatever extra that we're doing besides hiring and new systems and new ITs that we're building out to this. I mean, if you think about it, we literally have 45 days to go back into our systems after this got passed, which is, I don't know if you guys know anything about IT to build this up. It's a lot to go into it. And we want to make sure we're capturing all the asks that are outlined in the document. So I'm just going to leave it at that. And I know there's questions that people have raised their hands for.
If I can respond, Diane, thank you very much for that.
Yeah.
And make a question though, so because we don't want to keep going back to legislators where I did once on the 10 days. Now we're going to go back on this thing. Is there anything else that either you or Gary have questions about the summary that the advocates produce? Because we really do need to be on the same page about what the requirements are.
No, the only challenge I will say on that summary, Sheldon, is it is a lot of manual things we're going to have to. So let's talk about parts, right? Because that was one thing that was brought up earlier, if I can. So timing of it, we may put the very first PO order, and we're going to talk about it when we get to our component about timing from getting quotes from manufacturers, timelines on all the parts and when they come in, right? So we know that might pause it. And then that means, let's say it took us 7 days to get the part. And then we got the eval done within 2 days of the phone call, right? So 3 days are already taken up. So that tells me now, depending on when the part comes in, I have 6 or 7 6 days now to get this completed, business days in there. So we also got to make sure make sure we track not the weekends, make sure we're looking at. So the timing of all this stuff, depending on when stuff comes in and who checks it in, did they communicate back to my CSR to go call the person and say, hey, the part's in, can we get you scheduled? That's a lot of heavy lifting and figuring out the nuance of that. So we got to track that and figure a way we're doing it and build it into our systems. So we understand the 10 days, making sure that everybody understands. So do they realize they have to get a script because they're a Medicare client and we don't have the current script on file? Got to get that, got to chart that. So and I will show you guys how much IT goes into that and how much manually uplift that is. But we understand what the summary is for the intention of the 10 days total, without the timelines in between what's ever required from the insurance or required for the client. We get that. I'm going to pause it because Gary has his hand up.
Yeah, and I know I'm an ex officio member of this committee, but I do want to throw in that, to support Diane, the amount of IT time that's going into building this database. I mean, we do track all the dates of all this stuff. What happens that we're having a hard time tracking is when we can't get a hold of the customer, or when they don't return a call, or when, there's multiple parts and things like that on the order. So we're trying to get compliant on this. We're trying to meet the standards here, and we are improving on a day-by-day basis. But I just want everybody to understand the complexity that's going into building the tracking of this. If it's all a straight line, it's easy, but none of these are straight line orders. And to Diane's comment about the various payers, we did know going into this was all mostly based around Connecticut Medicaid, but we are capturing, I can speak for New Motion, we're capturing all of them. We are tracking all of them. So my data includes all, just because it's tough to separate it out.
Right, right.
Thanks to both of you. I just wanted to make sure that we're going to only go one time back to the legislators with any remaining questions. So basically, it sounds like that we're all in agreement. We just need to get clarification whether the basic timeliness requirements apply to Medicaid. That was the intention. And after that's resolved, then we all agree that the document is accurate, even though we understand the difficulties to some degree of producing the data. Thank you. Thanks, folks.
Thank you, Mr. Taubman. And thank you, Mr. Gilberti and Ms. Rascott. Mr. Morgana, you have your hand raised, sir.
Hi, I was going to ask, since staffing levels were brought up, I was curious, would the two companies be able to provide staffing levels in their reporting every month? There seems to be a challenge, and I've said from the beginning that the staffing is leading these issues. I mean, when you don't have enough people doing the job, you can't get the work done. So I would hope that both companies would be able to provide that information to us. And also the issue of OHA reporting and the questions, and then, obviously consumers don't always have the information that OHA may be asking for, but the two companies said that they have that information. If a consumer wants to call up and ask for that information, is that something you're readily willing to just help us with? Give us the information that OHA wants? That's a question for both companies.
I mean, we'll provide whatever data is necessary so long as we have a HIPAA approval to do that. I mean, I had an exchange with Adam earlier this week, and they're looking for information or how to approach us if they have a complaint. I asked them to come directly to me, and so long as we have a HIPAA approval, we'll be happy to provide information.
To be more specific, my question was, as a consumer, me personally, if I call up New Motion and say, hey, can you just help me out with this information? Would you be willing to give it to me personally on the phone so OHA doesn't have to go and do it?
Well,
As
yeah,
long as it's about your specific order.
Yeah, if it's your order, yeah, we always do. We get complaints
Okay.
and questions all the time from our clients.
Right.
I mean, whether you use the resources that are online, or whether you call in, or whether you email the branches, you have the right to ask for your information. We may verify it's you if we're not talking to you, and we're going to verify it's you because of HIPAA compliance. But absolutely.
Yeah, the reason why I asked that is because I think for the interest of time, it makes sense if someone's able to or willing to go to the company directly and just say, send me an email and say, hey, I need this information, send it to me. It just makes things faster, and it puts less work on OHA. But if OHA needs to do it, then that's something that needs to be determined between individuals. But what about the staffing levels? Would you be able to comment on your current staffing levels right now? And would you be able to provide that every month as part of your data to let us know your staffing levels? Because I think the lack of staff, as you've mentioned, is leading to these problems of getting repairs done in a timely manner.
But let me ask you a question. The staffing was not a requirement, but we know we can share where we're at. So, like, for example, we're constantly hiring, and we increased our staffing since May, June, before this even went live. Now I'm adding 3 or 4 more components because of the build outline. I'm constantly in the point of hiring. We're constantly have openings. We're constantly asking for people, and it's been a constant struggle. We've even increased rates on pays, and we increased all kinds of stuff. So we're adding more and more bodies, but it doesn't necessarily mean, David, that we're always going to have exactly what we need at the right time. So, like, for example, we're hiring, and we continue hiring. I backfilled 2 persons that quit in June, and now we got those backfilled. And we added 2 more techs, and we added more staffing. And I think no matter what, it's going to be an ongoing issue, because it's a very hard role to fill. It's a hard role to keep, and we're constantly over hiring.
So how many techs do you have now?
We're up to now, I think, I want to say 12, and we got 2 more that we're adding in. where we had 8 before.
How many does New Motion have?
I have to go back and look, but when we started this, we had 14 and we upped it to 16. So as far as I know, we're fully staffed today. But that doesn't, again, that's a tough thing to do because how NSM and New Motion qualify technicians is a little different.
People
But-
actually going out on the road, turning a
And
wrench,
that's what
or
I'm
people
using as
in
on the road, as our
Yeah.
numbers is on the road.
yeah, people on the road turning a wrench, or people in the actual shop turning a wrench. How many?
I said we have 16 today. I can go back and look at it. I don't track it on a daily basis. It fluctuates daily. Like Diane said, we got hit with COVID. We had some people out. Yeah, that's a variable number.
I've been given different information, but I won't get into that argument right now. Thank you very much.
If you're talking with our techs in shop, they don't have all that data. So, David, it is what it is. I'll give you names. I'll give you actual names.
I'm all set. Thank you very much.
Okay, thank you, Mr. Morgan. We'll move on to the report from DSS. Or Ms. Mahoney's comments on the report on DSS.
Yes, I know that you had wanted the department to report on maybe prior authorizations that were coming in, but because of the new change in the Public Act that was passed in 2024, the department no longer receives prior authorization requests for wheelchair repairs, so we don't have any data to present.
Okay, thank you. I just wanted that clarification for the record. Thank you, Ms. Mahoney. Okay, and now we'll move on to the report. I know we've had a lot of discussion on it this morning, but let's have the industry have the opportunity to provide their report and the context behind it. So I will turn the floor over to you, Ms. Rascott. Thank you.
Yes, so in looking at it, if we want to pull it up on screen, if you could, Chandra, I appreciate it. Thank you. So really what we're trying to look at is each of, it's hard because to the point we don't have the exact same reporting systems, how we're developing it. We can each speak to that. I wanted to look at where we're at the beginning of the year and where we increased overall between our systems that we are using. And then the improvements that we've had, the intent is for it to keep going down. But then when you go down to the bottom, if you move down the screen a little bit here, looking at over 745 repair orders that were new since July 1, looking at those between the two companies, what was in the primary insurance, what was secondary, if the primary insurance required either a script on file or a prior auth, those were over half of those orders that we got approximately. Being able to call back to the customer within 1 business day. We had tracking on that for one company. The other company didn't necessarily have that broken out exact just yet. Evaluations within 3 business days. Each had a little bit different how they were put into their systems, but it appears like 75 to 85% met those with improvements in August. And then of course the POs within the first day. This is one thing I want to discuss. And I think both of us can give you more details for each respective company. But the one thing I've noted for us, because our manufacturers that we deal with, we send out, so let's say we create an order and we go out and do the evaluation and the technician says, okay, I see you need XYZ parts. We go into our systems, and Gary, please back me on this for years, so I think it's very similar. Once we get those, we immediately put those into the system. If it's not a part that's required in our branches already, even if it is, we'll put it in because we know it's 0 days. But when we're putting those parts in for the various manufacturers, we have to get back from them either a quote or whatever the evaluation, the invoice for that part. The one thing I noticed when we started doing our tracking and timelines like this has taken too long to get answers back from our manufacturers. And so what this does is typically what you would think, you put it in the next day or the same day you're getting a quote or spec back from the manufacturer. For us, at least in our company, that's not happening that way. And I think Gary's the same way because we're dealing with all the same manufacturers. The quotes are not coming back that same day or immediately. In fact, some of them are up to 5 days, depending on what the manufacturer is. That's too long for us to wait to get an answer back on the part from the manufacturer. I don't know, Gary, if you want to add to what I'm saying, because that's one thing that we are talking internally to try to bypass. Now, what some things we do is with, depending on what the insurance is, we know we're probably going to get approval. We know we can probably get that part with no problem from the manufacturer. We might, what we do call credit accept, and just throw it in the system and order it regardless, right? It's a gamble. Sometimes we do that. That's something we're looking at, possibly doing that for all orders in Connecticut, even though we might not get paid for it, whatever it may be. But this is something that we're challenged with. That was pretty glaring once we started building our statistics around this. So I want to pause there, Gary, in case you want to add something to it that I may have missed.
No, we're seeing the same thing, and we do a similar process called release prior to funding, which basically we assume the risk. But that's not it's, if we have a pretty good level of confidence of get the equipment's getting covered, but we can't do that across the board. That's just laying out a lot of risk. But again, it's a situation in the process that does eat up time if the manufacturer doesn't send us a quote back in a timely fashion, excuse me.
So these are some things that we're working internally. I mean, we're trying to change processes for outside what we normally do with business across the rest of the nation with our manufacturers. So this is something that is being addressed, and we're looking at that, what we can do for timelines around that. If you can go down to the next one, performance in a 10-day window. So this was clarified. So this is going through, when you look at everything, depending on what it is, with the timelines that were discussed last week, whether or not you're gonna get those after we get our extra PAs or all the products in, how fast are we getting out there to hit that 10-day window? So when I looked at this after seeing the internal email that came out, I went back and pulled ours to look at statistics where we're averaging. And typically, if I was to look at this 10-day to go, I'm probably missing this. Then if you add those 2 or 3 days, like we talked about earlier, they're probably averaging like around 12 to 13 days versus the 10-day. So that's one thing I kind of looked at, but I want to stay there because like I said, I want to be able to have you guys ask questions. If you have certain things that we're building out, I can share exactly what we're doing and building into our systems for the more detail that's part of this bill. I know exactly why we missed and how many we missed from our order volume. And then Gary probably has some details in that. So I'm just going to pause there because I'm sure you guys have questions. And so I kind of want to just kind of go from there and discuss where we're at, what we're going to, whatever else may come up from this.
Mr. Brizio, yes.
Thank you. I went back and looked at section 2, lowercase d of the law. And I understand that your IT departments are sort of still building this plane while we're asking you to fly it. But the section D says, and this refers to the annual report. It says the report shall include minimum, maximum, and average times for the various data points that the legislature calls for. I would find it useful if in future reports, if you could give some of that data.
Yep. And like I can give you that, like, for example, for our orders, we had 132 orders that were within, how many did not get the customer call back within that first day? I had 5 of the 132. Evaluation with business days, 17 of the 1,332 orders missed the evaluation window. 5 were related to client timelines, 12 were related to staffing shortages. 28% were done remote with the evaluations. 17% were done in facility. Keep in mind, when we talk about facilities, these are long-term care facilities, 9 times out of 10. 20% of the evaluation was done in the branch. 34% were done in a home. And then when you look at the PO orders within that, all of them got them in within the day's time frame with put into places of orders. But what the kicker was, is what we were speaking to, is waiting for quotes to come back from manufacturers. This was a concern because it was 5 days longer than I wanted to be for our average time in the field. And then when you looked at the window, looking at for what the orders that we missed, there were 24 orders that were missed within that 10-day business window of what you're speaking to, of the actual timelines that Sheldon and the group all outlined. Of those 24 that were missed, they were missed within 1 to 2 days, 3 days of the 10-day window.
Okay.
So we are tracking those things. We are building those out. We already have it, but we want to make sure we have all the reasons that were outlined also in the bill, which is drop downs that we got to design into our system. So that's a lot. And also in addition to the staffing and dedication that we have now to track everything. So we have a separate person that's going to be manually tracking all that stuff that we're doing and going in and double checking on it. Why is that missed? So there's a lot of additional things that are being asked now for each step that you have to build out, and to be able to build out the report if you guys now want it monthly versus at the end of the year that was per the bill guidelines. We got to get this done and not manually track everything now, right? Because you're going to want it in a report size, whatever way format with each of those components. And if I could,
I agree that it's an undertaking, and I appreciate that you're doing it.
Yep.
And you know, speaking for New Motion, we're trying to build the systems the same way. You know, NSM had some of that because they had to do it for a specific payer, and we didn't have that. So, you know, and because I just joined this committee, and we haven't built it as quickly as they have, but you know, we were aiming towards the year-end report. But now, knowing that we want to report this out on a monthly basis, I will hope to have better data for you next month.
Thank you very much.
Thank you. Are there any additional questions? Mr. Taubman?
Yeah, a few questions about, you know, future reports, and we obviously will greatly appreciate, as Jonathan asked, you know, for monthly reports on this. First of all, there's and this has been a problem right from the past as well, that it's a consolidated report. I mean, the one good thing about a consolidated report from both companies is that, and I know you're still working on it, is trying to have a similar, or not the same, you know, parameters, and so that they are consistent the way it's done. We appreciate that, but it's not broken down by company. And it seems, even by the section that Adam was just reading from, it's talking about a wheelchair dealer has to do that, not sort of the industry. And it would be really helpful because there are differences, and there's different staffing and a lot of different things going on, as well as you know, market share. I'm just wondering if you could, going forward, since you have to produce the data separately anyway, and then it just gets consolidated, if you could break it down. So New Motion versus NSM. That's my first question. Now, if you want to answer that one before I go on to the next one.
Can I ask you a question though, Sheldon? What's the intent?
The intent is that there could be some basis for saying, well, this company is doing better than the other company, and why is that? What can we work on? Or this company is doing better than the other one, and we also compare that to the market share, so which could explain it, but maybe it doesn't, or maybe it's the opposite what market share would say. Or we have a different, I believe Gary said there are 16 techs at New Motion, and you said there's 8 at NSM. That's a big difference. I know there's different market share, but the point is that all those things could go in. We don't have enough information to figure out where the remaining problems are without actually having it broken down by company.
You know, Sheldon, I think, you know, we can discuss that further. You know, my intent has always been to get better. Okay. And we're showing improvement. We continue to show improvement. You know, the industry is trying to get better as a whole. And I think the aggregate data is as important as anything. And if the intent is to come at one company or the other. I don't subscribe to that process. I think we want to get better together, and we want to handle more consumers more quickly. And so I think aggregate data is better, but I'm open to discussion.
I think aggregate is helpful as well, but I mean, what the law says, the subsection G Adam cited, is that an authorized wheelchair dealer shall report this data. So it doesn't provide for, but I think it'd be ideally is both, right? Is each separate company plus the aggregate. Anyway, that's the request, and thank you for considering it.
Right.
Oh. Could I go on to the other ones, or should we call him Gerald? I don't want to hog this.
No, I mean, you have the floor currently, Mr. Taubman, so please feel free
Okay.
to, and then we'll get to you. We'll get to you, Mr. I promise.
All right, thanks. You already agreed to the suggestion from Adam, what says in the law that to provide not just averages, but minimum and maximums on all the figures were relevant. But with regard to the specifics of number 4, performance of meeting the 10-day window from all part orders after, prescription. And you were saying this was premised upon, and then it says between both companies, average of 80 to 85% of orders hit that timeline. That was premised upon your previous reading of the 10 days. So with the other interpretation, which is that.
And I made that comment, Sheldon, we added 3 days onto that.
Okay, so, but I know you said that, but I don't know what that means, because you said that it says.
That is with the interpretation of what you guys outlined, 10 days total, even with the pause, you still have 10 days to get that. So the average went from the 9.5 that I was making before, using the original thought that was after the POs are in, but it's not. It's including all times. So it went to 12.3.
So in other words, what you're saying is when it says average 80 to 85%, that was, we're hitting the timeline defined as 13 days. Is that what you meant? So
yes.
do you have, I mean, whether you have the data or not, obviously going forward, we'll want the data for
it will be like an equivalent that was discussed and outlined earlier.
Okay. And then again, average versus minimum maximum. And then the last thing, I did want to second David's suggestion of reporting. I acknowledge it's not in the law, but you did report it back in November for the task force, and it's really a central thing as a number of staff. And I do realize it's fluctuating, people leave and all that. But if you had it by a certain day of the month, and just at least report for each company reported on the 1st of the month, 15th of the month, how many staff you had, how many tech staff you had, at least we'd have some baseline. Is that a reasonable request?
It's funny how we're able to change what the requirements of the bill are now to add additional things. I'm
No,
not going to say,
know.
I'd be more than glad to share where we're at, but there's also other companies in the state that haven't reported anything.
Right.
We're not the only two. There are a couple other companies and no one's reported anything.
Well, in any
I
event,
see the intent here seems to be a little bit of a divide and conquer, Sheldon, and I'm going to say that directly to you. Yeah. The intent of this is to improve the service to the clients, and that's what we're heading towards, and that's what we're going to keep reporting, and we're going to keep doing what we have to do. We're going to try to get as compliant as possible to all of this. The intent I was hoping of this committee was discuss the challenges that we're at, and where can we get some more help. Now, I would love to discuss how can you guys help us get more staff. I need people to apply to these jobs. I need help. I need techs. I mean, I can throw all the money in the world, but if I don't get nobody coming and nobody applying and nobody being willing to add to our teams, that's a challenge.
I'd say during the task force, there were suggestions made by some consumer advocate members of the group. But I will also point out that Gary made it very clear during the task force meetings when asked by Senator Seminara whether you can find staff, and Gary said absolutely, there are people who have the skills. There was no ambiguity about that answer. So I mean, it's a little, now you're saying, oh, you just can't find the people, but it seems that that's not what Gary said in the discussions.
Sheldon, you're framing my words. But that I'm used to that. But look, yes, we have people applying. A certain percentage background checks. We're not sending people into folks' homes or having people work with folks who are not qualified to do so. Yeah, look, we're fortunate that right now we have a very full staff of folks, but that could change tomorrow. So I'm not going to criticize anybody who's having staffing issues today. I mean, if anybody is in business or has tried to hire anybody right now for any job, it's tough. But yes, you know, it has gotten better. Let me put that there.
We'll be asking you what the staff is at every staffing levels are at each meeting. That's all. But thank you very much.
Okay, I want to be mindful of time because we want to wrap up by 12:30 and we have some other additional agenda items yet, but let's move forward with these last couple questions. Mr. Roop, you've been very patient. Thank you.
Yeah, no problem. Thanks, guys. Yeah, one thing is, you know, certain parts I understand POs that you guys typically bill once when all the parts come in. Say it's a multiple order. If you have like a backrest from ADI, you got a cushion from, you know, another vendor or wherever it comes from. So I understand you guys have to wait till all the parts in that manufacturer's, you know, communication there. In my instance, it was 9/1 where the part arrived as per the the customer secretary that was reaching out and we were discussing together. And I do think that lag of time to reach out to me, especially with the use of routing software, you know, that's another hurdle that's getting parts to customers to repairs. So I do think we need to, you know, look to streamline that. And I do see that we need, you know, to just streamline that. But also, you know, you're looking that we need to hire some. I'm just curious, what does a tech get paid? Like starting salary, you know, full-time rate, is that with benefits? What is it? Because, you know, I could try to help recruit, you know, that's why I became passionate in this field. And, you know, after I was injured and I want to better the repair for everyone, you know, it's been a long-term thing, but it's continuously a battle. So I guess what are your guys' competitive salaries that you're offering?
I don't have that right off the top of my head. I mean, I didn't have that in front of me, but I'm sure I can pull it up and have that for the next summation.
Yeah,
But
I mean,
that rate increase. I want to say 23 to 25 an hour or something like that, and that's not including benefits.
Yeah, that's you know, that's similar to our range, and it depends on the skill set. I mean, if it's experienced tech, they could be making, you know, 25 to 26. If it's somebody that's just starting out, it could be 18 to 20. It just depends. But that does not include benefits. It does not include benefits. That's just raw.
Okay, because I think that's something too as well. You know, I know it's techs are probably getting burnt out. They're getting, you know, a handful of jobs. They're getting pulled around different areas. So I understand that battle, but maybe we need to look into, you know, some different incentive that way, just to keep your staff and limit burnout.
Yeah, excuse me, Daryl. And we're competing against Amazon and in place, you know, some places other, you know, large companies that are, you know, kind of coming into some big metropolitan areas, and they're throwing money at people that we can't. Yeah, our revenue is fixed because our reimbursement is fixed. I mean, we can't just raise our prices like Amazon or somebody can, right? So we can't raise our labor costs at the same rate that some people can. So
yeah, no, totally understand that. I understand that. Yeah. And I know we talked about this during the task force about like your guys are making that money up front from the sale, you know, and then that might kind of bleed out into what you got to dish out for the repairs too as well. You know, it's a, you know, part of being in an industry. But yeah, thanks guys.
Thanks, Mr. Roop. So it seems that the discussion of the monthly data presentations will be ongoing in terms of format, things that we may or may not be looking for, potentially in addition to the legislation, questions that'll be asked on a monthly basis, so on and so forth. First and foremost, we'll get a clarification on the legislative intent with respect to Medicaid and the bill, so at least we can have that fixed for you know, certainly hopefully for next month and moving forward. I do want to get to, I know Ms. Rascott, you requested time to discuss the cease and desist letter this afternoon. Now that we're in the afternoon.
Yeah, and the concern I had was that going out the way it came through, and keep in mind that was removed afterwards. We just needed a phone call would have been fine versus sending this cease and desist letter. Keep in mind our phone systems are nationally programmed across the board, and we do have the right to tell people, hey, you know, if you come in, this is going to be quicker, whatever. We did go back in that same week after we saw that and took out that voice notice for the Connecticut marketplace. But again, it's as a standard across the board. It was not like saying you can't come in. We do it, as I shared, over 80% of our stuff's in the home anyways. But that was addressed. And I just want to make sure everything was very clear about that. In the future, I just ask, give me a call, shoot me an email. What is the question? That was really not really necessary.
Yeah, and at least from our part, we're here in good faith. We really want to have a dialogue and work to make this better. And yeah, I know that letter was directed at NSM. Our systems are the same. Our phone system is national. When you dial the number, you get a centralized number. So.
Thank you both. Are there any comments or questions on that in that regard? Mr. Tubman, yes, sir.
Yeah, I mean, I think that what the cease and desist letter was talking about was sort of the combination of two things. It said it could be 21 days, which was inherently, I mean, the recording says it'd be 21 days, which is inherently non-compliant with the law. But also it said you can get it, but you can get it quicker if you come in. And although it is not impermissible to give people faster service if they come in, it's not permissible to give them service which doesn't comply with the law and then only comply with the law if they come in, right? So it was the combination of saying, giving out information, and maybe it's honest information. Maybe that's how long it's taking, which is a real problem. But it's you can't both say it's going to take way long, out of compliance with the law, and if you want us to comply with the law, basically, you're going to have to come into the shop. That's sort of what the combination of those things seem to say. Can I ask what it says now about coming to the shop?
It doesn't. We don't have
Doesn't say
anything on
anything.
there now. Just you call in and we're just gonna address what's on there.
Okay, so people don't have to affirmatively ask, hey, I want you to come out to my house. It's assumed you're coming out to the house then?
We ask how they would want them done when they call in.
Thank you.
Yes, Ms. Garland.
Thank you. I would like to address two things, I think. One would be the fact that the number is national, and to that, I mean, I understand that most corporate numbers are, and I guess it would be best then to make sure that your national numbers are not violating state laws.
Ours are not national, by the way. Ours is local.
I'm sorry, I thought you said it was. I apologize.
Gary's is national, ours is local, but our voices overviews of it typically are programmed nationally to have the same continuity between each location.
I understand.
That's what was different.
Gotcha.
Our call does get routed locally, okay, but the first call goes into the national 800 number, and then it, based on where the customer is calling from, then it goes. But that by that time that voice prompt has already been given.
Mhm.
So,
well, any national voice prompts, I suppose it would be good to ensure that they're not in violation of any state laws that affect you. As we've learned.
Understood.
Yeah, that's all. My second thing would be regarding just calling. How? I went to the National Seating website, and there's an email form, a number for customer service. There's no way to get in touch with like anyone of any significance. I've called that number and ended up in a circle many times. If you recall, I accidentally sent this email to your personal email address because your business email is not publicly available. So I am sorry that you felt, I guess, attacked by this email. That was not the intent, but also the leadership of this company is not particularly accessible. So here we are.
There is on our site, and I don't feel attacked. I was just letting you know you sent it to my personal versus the work site. There is info@nsm.com. When you go to our websites up in the top corners, there is information to send general inquiries. That's all customers. So there is ways of communicating. And when you go to the other link side too for leadership, there's ways of directly communicating. So if that was not seen, I'm more than glad to show you at a separate time where those are at.
Thank you. I poked around extensively and also Googled extensively and was unable to find any of that information. So that would be very helpful. Thank you.
Okay, any other questions or comments on the cease and desist? Okay. The next bullet.
Okay, we will move on to our next agenda item, and just keeping note of the time, we have 10 minutes left. Conversation on communication to the consumers by the industry thus far. I believe that was Sheldon.
Sorry, yes, I raised the question at the first meeting about whether the companies were advising consumers about the new law and about OHA and about, you can file complaints with OHA. And Diane said, you get back, discuss and get back. But since then, we got the report from OHA and the presentation by Adam. And I think that there's two things. One is there's not that many cases, and he explained, why that likely is. People don't even know that OHA is OHA traditionally, if anybody knows, is like, insurance problems. And they just wouldn't have a reason to go to the website to check. So there's a real problem there of outreach, and he doesn't have the list. So that's the answer is you guys have the list, you know who your consumers are. So you could reach out to them directly. And then the other thing is, as with the two questions, one which was resolved about the 10 days and whether it applies to Medicaid, even folks at the companies don't know what the rules are. So it seems that education is really necessary here on both what the new rules are and once we've agreed. And, if there's a problem that you can file with OHA and how you do that. So I'd really like to hear from both companies about what you're willing to do to communicate with your consumers. You do have a list about these new requirements.
From my standpoint, I don't know that it was on us to promote the bill. I think we're going to live up to the bill. We're going to get to the point where we live up to the bill. But I don't think it was on us to tell every single consumer about the bill. But we assumed that the state and others would be promoting it and touting it and educating on it. We need to educate our people. Our employees need to understand what the requirements are. And that's on me. I will make sure our employees know it.
I'd like to hear from Diane too on this, but the problem is that as Adam said, they don't have the list. It's I think it's 5,500 is the custom wheelchair users, and then the scooter folks. Actually, it's even the law, even timeless applies even to non-custom wheelchairs, so maybe 10,000. But there's no way to reach them. There's no specific way, and even the state doesn't have that. So I'm just, how how would such outreach even happen if the state was willing to do it?
Well, I mean, that's the Medicaid program, and they have those. They have access to that, so they can certainly, promote it to the Medicaid beneficiaries. Otherwise, disability networks that you all already use. I don't know, but it was never said to us that it was on us to promote the bill.
No, I was just asking what you were willing to do. I can very clearly see the distinction between what the law requires versus what's being asked of you. And I was asking, and I just like to know what Diane thinks, having been asked last time.
And I told you what I thought last time, because I already know you guys have advocated and thrown those out and had enough notices. I see the Facebook notice, I see the stuff. Our job right now is to get our team doing what they're supposed to do to be compliant with the bill. And now if there's something you're asking for us to do additional outside of that, we'll converse with that. But at the end of the day, I got to focus on our team doing what we're supposed to do for the bill compliance. And that's where my focus is at right now. We've already took out the voicemail on the other things. We're going to do everything we can do to make it sure we're compliant. But now if you're asking me to be an advocate on top of it and educate what that is, what is that going to look like, Todd, Mr. Sheldon? What's it going to look like in your eyes as adequate?
Well, I mean, once we have agreement on what the summary of the law is, you just could provide a link to it. Just say, here's the law, and if you have any concerns, you can file a complaint with OHA. Pretty straightforward.
I'd rather have concerns come directly to us so we can address it and do it versus going OHA. And people do call them following complaints, and we do follow up on those. So I don't want to miss that component.
All right. So just for purposes of the minutes, what you're saying is neither of you are willing to do this. Just to be clear. Is that fair?
I'm not going to say that, Sheldon. I'm not in a court of law right now. I'm trying to answer honestly, like we were not informed that we had to inform everybody of this, and I'm just going to state it as that, and that's all I'm going to say at this point.
So you're not at this moment. You're not willing to do it. Is that fair to say? I just want to know what the story
it's not.
is.
It's not fair to say, and I'm not going to say
you willing?
anymore.
Okay. Will you come back next time and give us an answer as to whether you're willing to do it?
I am going to say I need an understanding what you think is adequate and what does that mean before I'm going to say anything.
I'm only one person. I gave you my suggestion would be say there's a new law. Here's a summary link. And then if you have any concerns with timely repair, you may file a complaint with OHA. Here's the contact information. That was all I was thinking of. I don't know what other people think, but that's what I was thinking of.
I don't know that there's any precedent relative to that kind of legislation where it's on us to promote it. I would love to, here's something along those lines. It's not required in the bill. I'm not saying we won't do it. I have to talk internally with our folks about what we are willing to do. I'm not giving you an answer one way or another right now.
Okay, I'll just leave it this way. I'd appreciate an answer next time. Thank you.
Yeah.
Okay, Mr. Morgana has a question or a comment, and then we'll wrap up for the day.
I think it would be good for the companies to, I guess, at least provide a link to the information that's on the OHA website to just educate their consumers about their rights. It's, it would be a simple email since you have all the contacts, or perhaps if the companies would be willing to figure out a way to provide the email contact so OHA or somebody could send out the information to educate consumers on their rights. Thank you.
Thank you, Mr. Morgana. If there's not any further questions or comments, we look to schedule these meetings about 4 weeks out, and so that leaves us at Tuesday, October 22nd, and we'll keep it at the same time. Okay, without any objection, is there a motion to adjourn?
Motion to adjourn.
Sorry, I had a question.
Okay,
I wonder if between now and when the report is due, that is to say the council's report due in December, right? It might warrant biweekly meetings. I just feel that we didn't, I mean, I know that I asked a lot of questions. I took up a lot of airtime, but I was actually holding back because I realized we only had an hour and a half. And I'm just wondering whether that might make sense, just through to December.
Scheduling the next meeting a month out to give the industry a time to first of all, we need clarity on the law, which we're not going to get necessarily by the end of today. And they need, I mean, let's be fair to the industry. They need time to put data and numbers together. And I don't think that they are necessarily going to be able to do that in the next 2 weeks. So I think for the purposes of this meeting, we'll push it 4 weeks out, and maybe we can consider meeting more often after that. Does that seem fair?
All right, thank you.
Thank you. All right, meeting adjourned. Thank you, everybody.